Welcome to Pawsitive Health, where we believe that pet owner education leads to better pet health. Just a friendly reminder that any and all information in this video and in this channel in general is for informational and educational purposes only. It should not be used for any diagnosis or treatment advice for your specific pet. Please contact your veterinarian for your specific pet needs. My name is Dr. John Adam. I'm joined here with fellow co-host Devlin, a fellow pet owner. How you doing, Devlin?
Doing all right.
Good. What are we talking about today?
So today's topic is going to be teeth, chompers.
Teeth.
You know, never really thought about pets' teeth before. Probably should have been. But you know, is it really that big of a deal?
So usually by the age of 3, the number one disease that we see is dental disease. And that far beats allergies or, broken bones or vomiting, diarrhea, anything of that nature. Usually the number one thing we see is dental disease. And unfortunately, it's also the number one disease that's overlooked by pet parents and veterinarians too. So us as veterinarians and also pet owners as well need to be a little more diligent in diagnosing and treating this particular disease, because it does not only affect the mouth, it can affect their attitude, cause pain, discomfort, can affect other parts of the body as well.
And I'm sure most people are probably just thinking it's bad breath.
Yeah, I mean, a lot of people will bring them in just because their breath smells bad, and usually disease is pretty far along once you get to that point, where you've got, a very young puppy with puppy breath and their teeth are fine. But with that, bad breath is just a sign stating that there is dental disease. There's a lot more to it than that. Usually it starts with bacteria that form a biofilm called plaque, and then that plaque turns into tartar buildup. So yeah, you have plaque, and then the plaque turns into tartar and calculus. That tartar and calculus, along with the bacteria that's in it, causes inflammation, which is gingivitis. And when you have that inflammation, especially around the root of the teeth, you'll start getting damage to the bone around the teeth, and that's when you get periodontal disease or periodontitis, inflammation, destruction of the bone, loose teeth, and infections.
And I know with humans, like it can be one of those things that has like a cascading effect on the rest of the body. Is it the same with our animals?
It is definitely the same with animals. With them, they can not only affect their mouth and cause pain and discomfort, but it can affect the other organs in the body because of the bacteria. Can get into the bloodstream and affect their kidneys, affect their heart, affect their liver. If you've got a diabetic animal, infections in general, especially infection in the mouth, can actually turn a controlled diabetic into a not controlled diabetic. So it's not just a disease of the mouth. It is definitely a systemic or body-wide disease that affects the dog or cat in general.
That I'm sure they eat less when their teeth hurt too.
Yes, and honestly, that's something that most people, when they have advanced dental disease, will bring them in for it, because dogs and cats are usually pretty good about hiding their pain, especially dental pain. And so when it gets to the point where they're, not eating as much, or maybe they're not eating their dry food, or they're preferring wet, obviously, or they're dropping food. Of course, they're smelling the mouth. They're chewing on one side, maybe. That's when usually the dental disease is pretty advanced now, and it's getting into that periodontitis and periodontal disease. And unfortunately, those are times where we're having to extract teeth and sometimes a lot of teeth.
Yeah. In fact, we were just talking about this before we started recording. One of our dogs has like this pocket that's been going on in her mouth where when she eats, like food will get stuck in there and she'll try to be, pawing at it to get it out. And she'll come to us so that we can, kind of massage her gums a little bit and get it out. But, is that part of this, the pocket?
Yeah, so pocketing usually will start happening when you start getting the bone loss around the teeth. So, yeah, once again, you have that tartar buildup around the gum line, underneath the gum line, and that causes the bone loss. The bone loss causes the pocketing. You get food stuck in there that perpetuates the bacteria buildup and plaque formation, tartar formation, and just one big cycle, basically.
How fun.
Yeah. And even get to the point where I've had dogs come in for dental cleanings and they have what we call hair braces. So they've been licking their fur and everything, and it gets stuck in the tartar buildup, and it forms this wall of fur and hair around their teeth. And so that's usually when it gets pretty bad.
Yeah. So is this is truly then a disease if left untreated?
Yeah, absolutely. Disease that causes a lot of discomfort and pain for your pet. And what's great is that if you can be diligent early and take care of their teeth, like we take care of ours, we can hopefully prevent these severe dental disease and teeth loss and keep our pets nice and healthy and pain-free.
Yeah. Now, with a lot of things that are vet related, cats are significantly different than dogs for whatever reason. Is that going to be the same case here?
Always. And they're always going to be different, cats. So here's a little thing that I brought up. So with dogs, they're mainly going to have the tartar-driven periodontal disease, like we explained, where you get the tartar buildup because of the bacteria, and then that causes the periodontal disease. Usually, smaller breeds are more at risk. We always say that you're trying to fit a whole bunch of teeth into a smaller mouth, and so that crowding will cause more buildup of calculi and tartar and issues with the teeth. They also are more inclined to fractures of the teeth, especially dogs are eating or chewing, not eating, but chewing on, bones and hard toys. They'll fracture the teeth. That will also cause pain, discomfort, and infections in the inside of the tooth, or what we call the pulp cavity, and then causing abscesses and infections that way as well. Once again, doggy breath, or we call halitosis, or smelly breath, is not a normal thing. Just like with us, we shouldn't be having bad breath either. So it should be the same with your dog. If they have bad breath, that means they're starting to have some tartar buildup, plaque buildup, and causing some dental disease early on. Usually dogs are a little bit better with brushing than cats, although there's tons of dogs that are not great with it either. But once again, if you start early in life, get them used to it and slowly build them up to it, you can get dogs and cats used to having their teeth brushed.
And cats, am I seeing this correctly? Tooth reabsorption, so they're absorbing the tooth back into themselves.
So I'm just going to go over that right now. So with cats, they do get, tartar developed periodontal disease and all that. But one of the main things is, like you were mentioning, the tooth reabsorption. So with that, yes, they start eating away at their own teeth. And a lot of times this is underneath the gum line. So the crown's what you see. It may be perfectly fine, but then underneath that tooth root's being eaten away. And the only way you're going to know that is via dental imaging. One of the reasons why we recommend anesthetic dentals versus non-anesthetic dentals, which we'll go over in a little bit later. These can be very painful, especially at the gum line. And like I said, it can be hidden from our side as far as what we can see, even as veterinarians. I actually had a case today, a cat that we did a dental cleaning on today, and both his upper canine teeth, the big teeth in the front, the roots were pretty much half gone on both sides. It was causing some major discomfort and pain for the cats because the owner finally brought it in because they were eating less. Not necessarily not eating, just eating a little bit less. And so we had noticed that dental disease, and so we took him in for a dental, and we found that two of his big teeth were being reabsorbed. So we obviously took care of it today, and I'm sure he's feeling a lot better now. So another thing that cats get is they can be very sensitive to the plaque and tartar buildup to the point where they get severe inflammation in their mouth, not only in their gums, but in their mouth in general, down their throat, what we call stomatitis, which is a severe immune reaction to the plaque and tartar. Some of these cats, even if you're very diligent as far as cleaning their teeth, brushing their teeth, they may need to have almost full mouth extractions or up to full mouth extractions to eliminate the tartar buildup so they don't keep reacting to that buildup on their teeth. They are very good about hiding pain. They're very good about hiding everything. And so routine checks and dental cleanings are crucial with them. And then, of course, x-rays are very crucial because, once again, the teeth that or part of the teeth that we see may be perfectly fine, but then you take those dental imaging and the roots could be absolutely eaten up and horrible. And so that's when we know we need to take care of something versus just checking out the surface that we can see.
Yeah. For the dogs, aside from just generally small breeds, are there any other breeds specifically that are more prone to dental disease, or is this just small breeds in general?
I mean, all dogs are going to be prone to dental disease. Just smaller dogs, dachshunds, poodles, like it says there, chihuahuas, yorkies, they're going to be more prone to it. They're also prone to having retained deciduous or baby teeth that people don't take care of when they're younger, and that causes more crowding and more buildup of tartar and plaque, and more chances of periodontal disease. So they're more at risk. Dogs that have had issues with fevers when they were younger, or if their mom had a fever while they were pregnant with them, sometimes they'll develop something called enamel hypoplasia, where the enamel doesn't form properly around the tooth, and so it exposes the middle layer, which is called the dentin, and then of course that dentin is very sticky to tartar or plaque and tartar, and so those dogs are going to be more prone to buildup of calculus and tartar and getting periodontal disease as well.
Now, we should backtrack a little bit because I think we missed an opportunity to go over it. You have a slide for what periodontal disease actually is.
Yes, I think I brought that up and didn't show it. So,
yeah.
So once again, you got a healthy tooth, but then when you get that tartar and calculus build up underneath the gum line here, that's when you start getting the periodontal inflammation. Then you start getting bone loss, and so early stages of periodontal disease, you got about approximately 25% of the bone loss happening from the tooth root, and then more moderate disease, 25 to 50%, and then above 50%, that's when we start seeing like the very loose teeth that are just kind of falling out of their mouth. And unfortunately, we do see that a lot, where they just have horrible teeth, and we have to do almost full mouth extractions, and the owners are Not happy with that, but I mean, once again, if we just do our preventative and take care of things from the get-go, a lot of times we can avoid these severe cases where they have to lose most of their teeth.
Yeah. And aside from teeth falling out, what should we be looking for?
So things to look out for, obviously the bad breath, red or bleeding gums, the tartar buildup, which is that yellow-brown discoloration on the tooth. Once again, if they're dropping their food, they've got some dental pain, or if they're eating on one side of the mouth, if they're pawing at their mouth, obviously that could be that they feel pain and want to get at it, so that's why they're pawing at the mouth. If they're not wanting to, play tug of war or play with their toys, they don't want to bite down because it hurts. If their behavior's changing, if you got a grumpy cat or dog, or they don't want to be touched in general, there's usually some type of pain or discomfort, maybe in the mouth. When you get abscess, especially in one of the bigger teeth, what we call the carnasial tooth, in the upper maxillary teeth, upper teeth, you can get this swelling that's just below the eye. And that's usually an abscess from that tooth root getting infected and forming an abscess, and then it goes into the sinus there and swells up, and that's an infection in there. So we'll see that whenever we have that specific abscess going on in the carnation tooth. Yeah.
Which of these would be like the biggest red flag? Because I'm sure one of these at least is going to look like something minor, but is probably something major.
I mean, just seeing the tartar build up, the bad breath is another one. People just attribute bad breath to normal things. So, and then, like I said, there's a little bit of tartar buildup. People don't necessarily think it's a big deal until you start seeing those other signs and symptoms.
Yeah. All right. So now for that hard part, what are we supposed to actually be doing at home?
Yeah, that definitely is the hard part. And so brushing their teeth, just like with us, you need to brush your teeth every day. They need to brush their teeth every day. And then having routine anesthetic cleanings, usually once a year, sometimes more, depending on if your pet is prone to dental disease. Those are probably the two big things, just like with us, that need to be done.
So seriously, you have to brush teeth. All right. So we're just starting out, right? What do we do? I mean, I had a calico cat that probably would have turned into a fur NATO if I had tried to with her.
Yeah.
But what do we, how do we start with these squirmy cats and dogs? What do we do?
So, I mean, you want to start early in their life when they're young. And it's a slow process getting them used to, let me see. So first, usually we'll take the doggy or cat toothpaste and let them lick it. Usually it's flavored, so they'll like it. And so when you introduce them to this, like, oh, okay, this is actually pretty good. And then you can take it and then put it on their teeth and gum line, just kind of rub it around. And once again, they have the taste and they like it and they enjoy it. So they're fine with you kind of probing in their mouth and everything. And then eventually you can start using maybe even a thumb toothbrush or a finger toothbrush or even a regular toothbrush and add it in, put it on the toothpaste and just kind of lightly put it around the teeth. I don't want to say have to brush per se, but just kind of put it on the teeth, and then hopefully they'll tolerate that. If they start tolerating that, then you can start actually brushing quadrants one at a time until you get to the point where you're brushing the entire mouth and they're hopefully tolerant of it. And then, of course, after each stage that they pass with that, reward them, give them a treat, give them praise if that's what they like. So just slowly getting them used to you being in their mouth or a toothbrush being in their mouth, and then using rewards to help with that.
And then I imagine I have to use special toothpaste as opposed to just my Crest.
Yeah, so human toothpaste is not good for them, especially in the long term. We will rinse our mouths and spit it out. Dogs don't do that, they swallow it. And so over time, especially our fluoride toothpaste will be toxic to them. Also, there are quite a few toothpastes that are sweetened with xylitol, and xylitol is very toxic to animals. So we need to be careful with what toothpaste we use. Usually, you want to use a VOHC certified toothpaste, enzymatic toothpaste. That once again is enzymatic, uses enzymes to break down the plaque and tartar buildup, along with the mechanical brushing. The mainstay is the mechanical brushing of the teeth that breaks everything apart and breaks down that tartar and calculus.
And then, what about like the dental chews or like the water additives or like those dental treats? Are any of those actually effective, or is it just, a gimmick?
Yeah, I mean, some of them are gimmicks. Some of them do help a little bit. Once again, the gold standard is the toothbrush, brushing their teeth. If you want to use dental chews, especially if your dog or cat has a hard time being tolerant of their teeth being brushed, then by all means, it's better than nothing. So the dental chews, especially the ones that are VOHC, certified, those can help. But if you can't brushing is the best way to do it. As far as like the additives you put in the water and the wipes, I mean, they may help a little bit. They may help with the breath, but they're going to be supplemental. They're not going to be something that substitutes the brushing.
You kept saying VOC. Is
VOHC,
that so? What's that? And is that like how we can tell if a product is tested and trusted, or what?
Yeah, so there's these guidelines that the Veterinary Oral Health Council will test and accept certain dental treatments. And so if they have the VOHC seal, they know they've gone through that testing and guidelines by that council and are approved by them. So you want to make sure that those chews or whatever the dental product you're using is having that seal or certification, so that they are approved by the minimum guidelines by that council.
This doesn't mean I have to start trying to floss, right?
If only we could do that. I mean, honestly, if you could do it, go for it. I would yet to see someone try to floss their dog or cat's teeth, and you'll have to
put
that in video for me.
Can you imagine if somebody had tried it with Harley?
No. Can't get even a toothbrush within 5 feet of that cat.
Okay, so on your side, if we do one of those the dentals, you said the anesthetic dentals, what does that look like?
So we do recommend anesthetic dentals versus non-anesthetic dentals. The reasons are this. So under anesthesia, there are things that we can do that you will not be able to do with an anesthetic-free cleaning. First of all, is the imaging, dental x-rays. You will not be able to do that without anesthesia. And that is half the tooth that we need to look at. The other half we can see, and one half the roots you can't see. So the only way to assess it is via x-rays. And once again, especially with cats, you can have a perfectly good crown or part of the tooth that you can see, but then you find out they got an abscess on their roots, and so we need to take care of that and extract that tooth or whatever it may be. So dental x-rays are crucial in having a proper treatment for their dental health. The the other big thing is that non-anesthetic dentals cannot properly take care of the calculus and tartar buildup underneath the gum line. It's too painful for them to be taken care of without anesthesia, and that is the plaque and tartar that causes the dental disease. And so if you don't take care of that properly, your teeth might look white and pretty, but you're still going to have disease and perpetuated inflammation and bone destruction in their mouth. You can also do a proper oral exam while they're under anesthesia versus if they're not under anesthesia, it's going to be hard to do that proper oral exam. If you need any extractions, obviously you don't want to do that with anesthesia unless that tooth is pretty much falling off. You can kind of flick it off. I've had a couple times doing that, but majority of times you're going to need anesthesia to take care of any diseased teeth that need to be pulled.
Now, anesthesia, that's one of those things that will definitely scare a lot of us pet owners. So
absolutely. It scares us
is
too.
this, yeah, I bet. So like if we're going to be going in for these regular dentals, how risky is the anesthetic part? And are there, I'm assuming there's certain breeds and certain conditions that are like, all right, you're not doing that. You're doing the non-anesthetic.
Yeah. Obviously there's going to be times where we're absolutely not going to be able to, if they got, significant heart disease, they're got organ dysfunction, where going under anesthesia is a no-go, then we do what we can. We take care of what we can. But for majority of pets, even when they're older, I know people will ask me like, but they're really old, I can't do a dental. It's like, well, yes, they're old, but they're healthy. Otherwise, they don't have any diseases right now that inhibit us from going under anesthesia. Now, at any age, is anesthesia a risk? It's always a risk. I tell owners that all the time, is that you can't completely 100% of the time get rid of the risk of anesthesia. There's always a risk. We just try to limit it as best we can by proper exams beforehand, blood work beforehand to make sure all the organ functions and red blood cells, white blood cells, platelets, all that are fine. We usually have them on good monitoring that monitors their hearts, their blood pressure, their oxygenation during the procedure, as well as having good IV access during the procedure. We put a tube down the throat, that way we have an open airway that we can make sure they get well oxygenated. And then we try to keep the procedure as short as possible. Now, if you're doing these dental cleanings routinely, a lot of times we can keep these pretty short because the teeth are doing well and we don't have to do an extensive extractions or cleaning or anything of that nature. But if you're not getting a dental for 5 years, then yeah, they may be under anesthesia for a long time because you got 12, 14 teeth that we need to pull and make gum flaps and suture those and everything. So if you're very diligent as far as brushing their teeth and getting them in for their dental cleanings, these can be very quick and easy procedures that they're not under for long, and it limits that risk for them under anesthesia.
And it sounds like this is one of those things where, maybe a bit of money up front, but it's preventing a lot of more expensive things down the line.
Yeah, exactly. So it limits the amount of extractions. That's honestly the majority of the cost of our dentals is the extraction, especially when you got, like I said, 13, 14 teeth that need to be pulled. That takes a lot of time. And so it costs a lot of money, as well as, it's also helping with the comfort of your pet as well. So getting these routine cleanings, yes, it is an expense they have to do once a year at least, but you're keeping them healthy, pain-free, and will prevent, hopefully, other issues later on down the road that are going to be more expensive.
So if somebody sees one of those anesthesia-free dental places, or cleanings being offered at a fraction of the cost, are they basically getting what they're paying for?
I mean, yeah, they are. So you cannot compare an anesthetic dental to a non-anesthetic dental. They are not the same. Now, you can get those in between your anesthetic dental, especially if your pet is not good at as far as brushing the teeth and all that. Those are perfectly fine in between your anesthetic cleanings, but it does not substitute your anesthetic cleanings at all. And if you're able to, if your pet's able to, the anesthetic dental is always going to be the preferred method to take care of your pet's dental health.
Now, since we can get them in between the full cleanings, are they safe, or are they like putting our animals at risk?
I mean, there are still risks even without anesthesia. I mean, them going in there and breaking up the tartar and calculus can put bacteria in the bloodstream, obviously causing the issues we discussed earlier as far as bacteria going to their heart, their kidneys, their liver, and other organs. So there's that. They can cause bleeding, discomfort, pain if the operator, the person doing the cleaning, isn't doing it properly. A lot of times, if there is significant dental disease, good technicians that do these non-anesthetic dentals will stop the dental and say, hey, no, you need an anesthetic dental. You need to get this done first. So if they're good about it. So, but sometimes they'll keep going even though they know that they need an anesthetic dental. So you got to be careful with that.
If the pet's good, or if the parent's good?
The operator, the person doing
Okay.
the dental, the non-anesthetic dental cleaning, they should hopefully be educated enough where they can look in that mouth and be like, no, this isn't going to cut it in a non-anesthetic dental. And honestly, majority of times that's going to be the case. But if it's like a simple, there's some light tartar buildup on the top of the teeth, okay, fine. You can have that taken care of. But once again, that's not taking care of the actual plaque and calculus and tartar buildup that causes the dental disease in the first place.
And how often should we be bringing our pets in for all this?
At least once a year. Some dogs need it more often than that, but majority of dogs need it at least once a year, and cats.
I'm assuming the smaller breeds will need it more often.
Yeah, a lot of times they will need it more often. Once again, it also depends on how good you are as far as brushing their teeth every day. That, of course, is going to either make it where you can just do it once a year, or you may have to do it every 4 to 6 months.
Yeah. And then it's definitely going to be on a lot of pet parents' mind. Why is it so expensive? And what can we do to mitigate the cost? Is there Delta Dental for dogs?
I mean, there are insurances out there that will cover this. So do your shopping as far as pet insurance. I always do recommend pet insurance because it, especially nowadays, because it does help with that cost. But shop around, do your homework on that. But once again, just being routine about it, making sure they do come in every year for their cleanings, brushing their teeth as best you can, because that's going to limit the amount of time we have to spend taking care of their teeth while they're under anesthesia. So less anesthesia time, less cost. The less extractions, obviously it's going to be less cost as well. But the cost in it is, the blood work we have to do beforehand, because we have to make sure they're okay to go under anesthesia, doing the anesthesia, the tech time to do the cleanings, the doctor time for extracting the teeth and evaluating the mouth and looking at the dental imaging as well. So all that comes into play as far as the cost of an anesthetic dental versus a non-anesthetic dental. You just have a dog wrapped up in a blanket by a technician that's just scraping the surface of the teeth. Obviously, an anesthetic dental is a much thorough exam and cleaning, and potentially doing other things like removing the teeth, or there might be some other oral pathology that we need to take care of. So there's a lot more to an anesthetic dental than a non-anesthetic dental. And once again, an anesthetic dental is actually going to get to the root cause of the dental disease, versus a non-anesthetic dental will not. And so you cannot compare the two.
So if somebody gets, say, a kitten or a puppy, when should they start?
As far as dental cleanings go, I would say on average, at 2-3 years of age, you're going to start doing dental cleanings. As far as brushing the teeth, start right away. Get them used to it. As a puppy or kitten, it's the best time to get them used to it. Talk to your veterinarian, doing your frequent checks with your veterinarian, and they're going to be the ones that are going to check your dog or cat's teeth and see what needs to be done. So just having that frequent talk with your veterinarian is key and crucial to your pet's dental health.
Yeah, that'll probably be the first thing that we start discussing after this is done. So book some of those appointments. All right, so for our viewers, what's our one takeaway, our final takeaway from all this?
Once again, like we say in a lot of our videos, prevention is key. So doing your preventatives, taking care of those teeth before they become a problem, is key to not only their health, longevity, decreasing pain and discomfort, and just having a happy life for your pet.
All right. Well, everybody, like with your own teeth, book an exam. Book a dental exam.
Yes, definitely get that done and have that conversation with your veterinarian. They'll love to have that with you.
Good. All right. So, yeah, good episode. Where do we send everybody? Where does everybody get to find us?
Well, I mean, they can find us here, obviously. So if you found this video helpful, entertaining, I guess, please like and subscribe. If there's any other topics that you'd like us to discuss, please mention it in the comments below. We also have another community, the school community, where you can join like-minded pet owners in figuring out your pet's health, and you get direct access not only to that community but to myself as well if you have any questions about pet health in general. We also will be doing live Q&As that you can ask questions directly to me and other pet owners as far as your specific questions for pet health, and much more resources to come as well.
Nice.
And the link will be in the channel description and the video description below.
Nice. All right. Good talk.
Yes. Great talk about teeth. Love teeth.
Yeah. All right. We'll talk to you later. Bye, everybody. Stay healthy.
Take care. Yes, stay healthy. Have a good one.
You too.